Hi, this is Dr. Lucas Kowalczyk, founder and CEO of ProSketch. I just wanted to extend a huge thank you to all of our frontline healthcare workers and staff battling COVID-19. You all are keeping your communities as safe and as healthy as possible, and we owe you a huge debt of gratitude. Thank you so much. We really appreciate it. This week, we're going to be discussing telehealth, a very hot topic as it allows practices to continue seeing patients while maintaining social distancing requirements, which is critical. First, vendor selection. The most critical piece of advice I can think of is reliability over bells and whistles. You want a service provider that has the ability to scale up the demand during peak service hours. Microsoft, Google, Amazon, these are the companies that can really scale up very, very quickly. Next up, the stakeholders. When you're going to finally implement whatever vendor you selected, really critical. Communicate, communicate, communicate. You really want to get all of your relevant stakeholders on board. And the first and primary stakeholder is actually your support staff. They're going to be the ones running the bulk of your telemedicine program. Next relevant stakeholder are your patients. You're going to want to go through the entire process of a patient connecting to your telehealth system, and also test the solution on multiple devices, because there sometimes are little nuances between operating system and devices that you'll want to know about so your staff can effectively troubleshoot this. Next up are physicians. They're going to be mostly on the conferencing side of things and connecting. What's really important for your physician stakeholders, knowing how to document the telehealth visit. You're probably going to be billing a 99213 or an 03 for a new consult visit. Finally, your IT service provider. Good idea to plug them in on this process as well. Let them know what you're doing. Do they have any suggestions on your network? Or could they even offer suggestions on the vendor? So let's move into security next. Even though there's been some relaxation around HIPAA requirements, you want to go with a vendor that's experienced, that has a business associates agreement that you can sign. Commercial grade services have certain uptime requirements. They have encryption protocols. And really, those are the providers that you're going to be able to depend on. Another important point to consider on security will be your HIPAA requirements for working from home. And one of the big things that you really have to consider in this scenario is not downloading any PHI to local machines. That's really a big no-no, and you really want to emphasize that to your staff. So let's talk about going live. You've selected a vendor, you've communicated to all your stakeholders, and now you're ready to go live. So what's the main important thing here is, once again, communication and tolerance. You're probably implementing this over the course of the week, making a very, very quick decision here and trying to get this implemented rapidly. So expect some mistakes, expect some things to not go smoothly. Also, with going live, make sure that your staff is calling patients 30 minutes before their appointment, making sure that they've downloaded everything. So there's a little bit of hand-holding there, but just think about it like your regular check-in process to your clinic that they have to go through. And so I really think that that covers the main important topics of rapidly and effectively implementing telehealth in your practice. From our perspective, we would love to hear more about topics that you think we have missed or not covered, and we'd love for you to share them with our community. Share them via comments on our website or via LinkedIn. We would love to hear from you. Also, a huge thank you to all of you for continuing to provide medical care in your communities under such difficult circumstances. Thank you so much. You all are doing just fantastic work. We look forward to connecting with you on our website and via LinkedIn, so please reach out, and we'll see you next week for another article. Take care and good luck.